Hello everyone. Have you ever experienced severe pain on your calf muscles, especially during the night? Or have you seen twisted, bulging veins on your legs? If the answer is yes, you probably might be suffering from a condition called as varicose veins. Varicose veins is a vascular condition affecting millions of people across the globe. Namaskaram, I am Dr. Suraj Subhash. Today, we shall deal with the topic of varicose veins, its signs and symptoms, and how effectively can Ayurveda manage this condition. Varicose veins is a condition that affects 10 to 30% of the population globally, especially in the adults. The people who are more prone to varicose veins are especially women when compared to that of males. This is because of the pregnancy that brings a lot of changes, especially the dilation of veins, and also due to the hormonal changes that the women undergo. Let us now understand what exactly causes the varicose veins. As we all know, that heart usually pumps the pure blood throughout the body. The impure blood is pumped back into the heart. Now, when it comes to the lower extremities, the veins usually have finger-like structures inside them that helps the blood not to flow back again. The muscles of the lower limbs usually works and acts like a heart, and that pumps back the venous blood or the impure blood back to the heart. Due to many reasons, such as age, genetics, etc., the musculature or the muscles, especially of the lower limbs, can usually go weak. That leading to and also that leads to the damage of the veins, thereby allowing the blood to pool in the vein. And this pooling of the blood causes the veins to get swollen and twisted, thus causing varicose veins. The risk factors of varicose veins usually include age, genetics, and in gender, as I said before, women are more prone to varicose veins. Apart from that, obesity and long standing or long sitting hours also fall under the high risk category or the high risk factors for causing varicose veins. When it comes to age, as the person ages, the structures etc. gets weakened, thereby leading to the probability of varicose veins. When it comes to genetics, people who have a familial history of varicose veins are usually prone to develop varicose veins in the next generation as well. Women, like I said before, since being subjected to a lot of hormonal changes, and of course, due to the pregnancy that causes the laxity of the veins, are also prone to developing varicose veins at a later stage. Apart from that, obesity causes extra pressure to the vein, thus causing the pooling of the blood in the veins. Prolonged sitting or standing actually restricts the circulation, thus leading to the formation of varicose veins. Let us now understand how a person can identify if he or she has varicose veins and when he or she should meet a doctor. Varicose veins need not necessarily be visible at the initial stages. People might start experiencing severe cramp like pains, especially during the night, or they might even have a swollen feet. In some cases, the people also might have throbbing or burning type of pain on their legs. In advanced form of varicose veins, people will start seeing visible changes on their legs, which will be usually like a swollen veins or twisted veins. Now, in some cases, people also might start developing ulcers on the legs. These are the conditions that usually people can look forward to understand if he or she has varicose veins. And that's the time usually when the people approaches the doctor. Ideally, when they have a pain, starting unexplained pain, especially in the legs during the night, it would be a ideal time when he or she can approach the doctor, and it is better to identify the conditions at an earlier stage. So if a person has a persistent swelling severe pain, skin ulcers, or even a sign of blood clot, then it is ideally good to seek medical attention. Now, let us understand how Ayurveda sees varicose veins as. In Ayurveda, varicosity or varicose veins is usually understood as Siragrandhi or Sirajagrandhi. Means Grandhi is usually a kind of swelling or swollen part or a kind of growth. So this is especially there in the veins. That is why it is understood as Siragrandhi or Sirajagrandhi. It is understood as the imbalance of Vata along with Kapha. Hence, the imbalance of Vata can lead usually to the dryness and weakness, especially of the veins, and thereby causing the poor circulation, thus leading to the condition of Siragrandhi, or rather varicose veins. Let us now see how Ayurveda can help to manage the condition called Siragrandhi. As you all might know, Ayurveda has the immense power of the Panchakarma. Panchakarma is effectively used in the management of Siragrandhi, apart from giving the herbal medications or herbal decoctions inside. Among the Panchakarmas, the treatments like Raktamokshana, that is bloodletting, is found to be profoundly used, or it is quite useful in managing the condition of Siragrandhi. The purpose of doing Raktamokshana is basically to relieve the congestion and also to improve the circulation. The Virechana therapy, yet another powerful Panchakarma tool that is also employed in conditions of varicose veins, helps to detoxify, especially the liver, and thereby it improves the blood flow and also removes any blockages from the body. Apart from the Panchakarmas, the other therapies that can be used is usually Utsadana, that is a kind of reverse massage that is usually done with the help of certain herbal powders that can be mixed with certain oils specifically designed or specifically used to improve the vata in the body, is also usually found to be very effective in the management of Siragrandhi or varicose veins. Apart from the Panchakarma therapies, the use of herbal medications and changes in the lifestyle is also very much effective in the management of Siragrandhi. There are certain herbs or concoctions that can be used for improving the circulation of the blood and also strengthening the structures, and that can help improve the elasticity of the vein, and there are certain herbs that can help to detoxify the blood and also reduce the swelling of the body. The lifestyle changes that usually the doctors or the Vaidyas tell to the patients include eating of heavy or fiber-rich foods, especially like greens, nuts, or whole grains. That can improve or help to remove the excess mala from the body. Apart from that, the doctors might ask the patient to stay hydrated and to avoid prolonged sitting or standing. So, if a person who has a desk job, they might need to walk after every 30 minutes or 45 minutes. Or if a person who has a long standing job, will be advised to walk a little bit more, so that their musculature usually has a lot of activities and thus improve the circulation. Apart from that, pranayama and yoga can be also practiced. That improves or that helps to improve the circulation of the body. Varicose veins can be managed effectively with the right care, and Ayurveda always gives a holistic and a natural approach to heal and to improve the circulation by strengthening the veins and balancing your doshas. Thank you.